Hi, I'm Dr. Sherry, Chief Medical Officer of Women's Health at QuickMD. I am so glad you're here today because we're going to be talking about something so many women ask me about every day, using the estradiol patch or the estradiol pill. Today, we're going to talk about the patch and why a patch. How does the patch work? How can it help? Is it an estradiol pill easier? And what can I expect if I use the patch? So let's first start off by mentioning that our superpower hormone, estrogen, plays a major role in how almost every organ system in the body, including the brain, heart, bones, metabolism, and emotions, operate. During perimenopause, estrogen levels become erratic, and in menopause, this vital hormone takes a complete free fall. Hot flashes and night sweats show up, sleep gets disrupted, brain fog begins, mood swings feel unpredictable, and you start to feel like you're spiraling out of control. You may even start wondering if your body has switched to a completely new operating system overnight. This is where the estradiol patch can save the day. The estradiol patch gives your body back a steady level of estrogen in a way that often feels more natural and easier to tolerate the disruptive symptoms of menopause. Estradiol is the main form of estrogen your ovaries make during your reproductive years. When levels drop, your body definitely notices its absence. The estradiol patch delivers a bioidentical form of this same hormone through your skin. Bioidentical means the structure matches the estrogen your body naturally makes. The way the patch works is very simple. You simply place one on your skin and it slowly releases estradiol into your bloodstream. Now, since the patch avoids the digestive system because you don't take it orally, it doesn't break down in the liver, which is a very good thing from a health standpoint. This means the estradiol patch gives you a more steady hormone level without the ups and downs that some women feel when they take the estradiol pills. There are a few patch types depending on the brand and the dose. Some are small, like the size of a dime that you change twice a week. Others are larger and changed once a week. Now, the right choice will depend on what dose you're taking, your insurance plan, and how your skin responds to wearing a patch, and of course, your personal needs. A question I hear all the time is whether patches are better or safer than the pill form of estrogen. And I'm here to tell you that the patch is safer than taking the pill form of estrogen. Patches provide more consistent absorption and often fewer side effects. There's a myth that patches work slower and that they're weaker than the pills, and in reality, they're simply absorbed differently. So you are not waiting for your body to process the hormone. It's already being delivered in a very steady stream. Another common point of confusion is the difference between bioidentical and compounded hormones. Estradiol patches are FDA approved and are bioidentical. Compounding hormones are created in a specialty pharmacy and are not FDA approved and are not necessarily bioidentical and are not any safer than taking the estradiol patch or pill. Remember, bioidentical does not mean compounded. The estradiol patch is delivering a safe and regulated form of estradiol. Now that you know what they are and how they work, let's talk about why women use them and what benefits you can expect. Estradiol patches can make a meaningful difference for many symptoms of perimenopause and menopause. They help with hot flashes, night sweats, sleep disturbances, vaginal dryness, brain fog, mood swings, and other symptoms of menopause. Many women tell me they feel like someone turned the lights back on in their brain and their body, and they no longer feel possessed, and they start to feel much more like themselves. Now, beyond symptom relief, there are so many other metabolic benefits. Estrogen plays a significant role in how your body uses glucose and stores fat. When estrogen drops, many women notice that dreaded weight gain and body fat redistribution. The shift of the fat tends to go to our belly, also known as a menobelly, to our thighs and our hips. And as a reminder, hormone therapy will not replace diet or healthy lifestyle changes, but patches often help stabilize these shifts and make your efforts feel much more effective. There are also long-term health benefits. Estradiol supports bone density and helps protect against bone loss. It also has a positive effect on cardiovascular health by helping blood vessels stay flexible. Estradiol also improves blood flow to the brain, which helps with that dreaded brain fog, concentration, and memory lapse. These aren't quick changes, but over time, they really matter for your overall well-being. Now, who gets the most benefit from using the estradiol patch? Women who are within 10 years of their final menstrual period or who are in the middle of perimenopause often respond especially well. But it's not limited to this group. What matters most is your overall health, your disruptive symptoms, and long-term health goals. A common question is whether you can start patches while you're having periods, and the answer is yes. Perimenopause is actually a very common time to start using the estradiol patch. In perimenopause, hormone levels are fluctuating, and that's often when the disruptive symptoms first show up. You do not need to wait until your menstrual cycles fully stop to start hormone therapy. Another myth is that hormones are only for women with severe symptoms, and this is not true. Hormone therapy is about improving quality of life and supporting long-term health. If symptoms are affecting your sleep, mood, memory, daily comfort, relationships, sexual function, or just your ability to get out of bed in the morning, that's enough reason to explore treatment options. Now let's talk about how to use patches safely and how to get the most out of them. Using the estradiol patch is simple. Once you get into the routine, you peel off the backing and place the patch on clean, dry skin on your lower abdomen, hips, or buttocks. You'll press firmly for about 10 seconds to make sure it sticks. Women sometimes ask what to do if the patch falls off. Usually adjusting the placement will resolve this problem. And you'll want to avoid lotions or oils in that same area because they can affect the ability of the patch to stay on the skin. If you sweat or swim a lot, the edges may loosen or come off, but most patches are designed to stay on through exercise, showers, and even swimming. Now, if your patch does fall off, you can replace it with a new one and continue your usual schedule. Just don't double up on the patch to make up for lost time. A typical starting dose is often a lower strength patch, like 0.02 milligrams, and is changed twice a week, but this can vary depending on your symptoms. Some women need a higher dose to get symptomatic relief, while others feel great on the lowest dose. You do not need to check estrogen blood levels to know if you are on the correct dose. Your symptoms will help us determine the correct dose of estrogen that you need. And remember, your dose isn't a reflection of your health or self-worth. It's simply what your body needs. It's important to know that if you have a uterus, you'll also need to take progesterone. Progesterone protects the lining of the uterus from building up under the influence of estrogen, which can cause precancer or cancer cells. Estradiol patches alone are not enough if you have a uterus. Most of the time, estradiol patches are recommended as first-line treatment for your perimenopause or menopause symptoms. Women with a history of migraines, elevated triglycerides, or a higher risk of blood clots often tolerate patches better because patches bypass the liver. Now let's talk about risks. No hormone therapy is risk-free, but patches are one of the safest forms of estrogen delivery. The question that everyone asks is whether estradiol patches cause breast cancer. Current medical evidence shows that estrogen alone is not associated with an increased risk of breast cancer and may even slightly reduce your risk of breast cancer. When estrogen is combined with certain forms of progesterone, the risk can increase slightly over time. But the important thing is the risk is not the same for every woman. We know that a family history of breast cancer, your genetics, and lifestyle all influences your risk of breast cancer. There are contraindications or reasons you cannot take estradiol patches. Women with a history of estrogen-sensitive cancers, uncontrolled high blood pressure, heart disease, and certain blood clotting disorders should avoid estrogen patches and hormone therapy. And this is why medical guidance matters. You deserve personalized recommendations and care. When starting the estradiol patch, you will undoubtedly experience some normal side effects for the first few months, including breast tenderness, uterine bleeding, and abdominal bloating. Always follow up with your healthcare provider if you notice new breast changes, persistent bleeding, severe headaches, leg swelling or cramping, or chest symptoms. These side effects are uncommon, but should always be evaluated quickly. The estradiol patch can be a steady and effective way to replace estrogen your body is no longer making. They offer reliable symptom relief with very few side effects for the majority of women. Remember, they support bone, brain, cardiovascular health, and longevity. And most of all, they help women feel like themselves again. If you're already using a patch or thinking about starting, I hope this gave you more clarity and confidence in using them. Thank you for spending this time with me, and I'll see you in our next session.